Hello, welcome back to my lecture. This is the fourth part of my lecture. I hope you have watched the third part. And this fourth part consists of more details explanation from the materials other subjects in the third session. Factors that are needed to have an effective health communication is empathy, respect and trust, self-disclosure, and confirmation. Now I'll explain in details first about empathy. Empathy is an ability to place yourself in the other people's situation or position, or in other words, understand how the patient feels in a certain condition. So when the patient feels pain in his stomach or in her stomach, you, you can feel how the patient is handling or how the patient is feeling about the pain. So you know how severe or how light this pain that is the patient have. So you know how to treat the patient because you have the empathy to feel the, the emotion or the feelings of your patient. Secondly is respect and trust. To achieve the respect and trust of the patient, you have to accept the patient's view or situation without any judgment. You can't judge the patient from the patient background. You can't judge the patient from the different background of his or her religion, education, or her ethnic background, or are the same. Third is self-disclosure. You should have a mutual openness in giving and receiving information. To have a self-disclosure where the patient are openly and willing to give her or his information, all his data information that is needed by the doctor. Firstly, you have to gain trust and respect. Respect and trust have to be it's an important thing. So the patient can give information and data that's needed by the doctor. And last, confirmation, like we have just mentioned before, feedback that is always needed from the patient, but also should be done feedback given to the patient by the doctor. In effective medical communication, you need skills, general skills to achieve this effective medical communication. First, like we have mentioned before, you have to able to show your empathy on the patient, on what the patient are feeling or what they are facing. And secondly, you able to use appropriate verbal and non-verbal communication. I will talk more in details about this verbal and non-verbal communication. And you are able to observe the verbal and non-verbal communication of the patient. So while you are doing the communication, delivering the message, you should observe the changes in the patient behavior, in the patient gesture, his expression when you give the information. Maybe the patient feels depressed, there will be a change in his expression. You should always look at the changes in the patient non-verbal reaction from your by your message or your information that's delivered to the patient. And also, to have effective medical communication, you should understand the steps in medical communication. There are several steps or guidelines to help you to how to do a medical communication, medical interview, and so on. Now we talk about the non-verbal and the verbal communication. The verbal communication that I have mentioned before is the spoken words, what you are speaking, words you are saying, sentences. Those are verbal communication. But also written signs are also verbal communication. Written reports, medical record, instruction, prescription, and in electronic media, those are also known as verbal communication. While non-verbal communication is a person's gesture or person expression, the facial expression, the body language, handshake, how you sit, how you stand, or while communicating, always glancing at your watch or looking at your mobile phone, it will distract the patient. And always how you have eye contact to the patient, always have contact. So the patient knows that you are paying attention to the patient. Your voice, how you deliver the message, the information, your volume, speed, tone, and pitch. Those are non-verbal communication. And according to the terminology of non-verbal, there is kinetic. Kinetic is movement, gestures, facial expression, touching, handshakes, and eye contact. These are called kinetic non-verbal communication. While proxemic consists of space, time, and distance. Like a distance between the sender and the receiver, maybe at a certain situation, the patient is in front of us, or maybe a teleconference where the patient is in another part of the city or area. Like now, we have having a lecture. I've done this lecture. I've made this video lecture several days before you are watching. So different time, different place, different distance. The third is the haptic or zero proxemic. This concerns the no distance, usually between family members, there are no distance. While proxemic, this distance may be social distance or physical distance. Social distance is a relationship between the teacher and the students where there are distance, or the boss and the employee. That's a social distance. Physical distance, I've mentioned in different area. But haptic is more close to social distance, where there are no distance between the sender and the receiver, like a relation of your parents to you. There are no distance. The fourth is paralinguistic. It's concerning verbal language, your intonation, speed, and so on. We have just mentioned before. And your physical appearance, how you dress, how you stand, how you sit, that's physical appearance. So we have ended the fourth session, mostly explaining in details about the verbal and non-verbal and how to achieve effective communication. We will continue with the fifth session. Thank you very much for your attention.